My name is Julie Gould, and I'm an OBGYN here at St. Luke's. My specialties are obstetrics and gynecology. I'm a generalist. My care philosophy is treating people as an individual. Not everybody has the same answer for what ails them. People are looking for different approaches, so getting to know the patient to see what they're comfortable with, and then applying options for treatments accordingly is generally how I prefer to practice. I actually am from Reno, Nevada, and so I went to high school and undergrad there. University of Nevada, Reno, go Wolfpack. And then Des Moines University, and that was for med school, and then Mercy for residency. I decided to become a physician after doing research for 2 years and deciding that was not for me. So part of the way that I got into OBGYN is because I would go and actually do research on uterine tissue, so I'd get to go watch procedures. And after seeing that and after working in labs for a couple of years, that's when I decided that I didn't want to go into research and I would prefer to go into the clinical aspect of medicine. I chose to work at St. Luke's because I had colleagues that worked here that had great things to say about the hospital and administration. It is very important for us to have independence and be able to treat our patients the way we want to treat them, and St. Luke's allows us to do that. I think the biggest benefit of St. Luke's is how wonderful the nursing staff is, and that is what allows me to counsel my patients as to when they ask me where they should deliver. I can honestly say I think you should deliver at St. Luke's because everything about your care in labor and delivery and in gynecology is how good is your nurse, and the nursing turnover is very low here, and the nurses are consistent, and they can recognize when something is wrong, and they can recognize when it is that as a physician we should be alerted. So I appreciate that, and it's been consistent for the 11 years that I've been here. The staff have been the most important thing that really guides or that keeps me here. It's interesting how that answer changes as I age. So I used to always say I really enjoy working out and I really enjoy hiking and biking, and now I really enjoy watching my kids play sports. They're very active in hockey and lacrosse and golf, and I still do get out and I do golf and I still run, but it changes what your interests are as you age, and I just love watching my kids now. So my fun fact is that my favorite thing in the world is probably my dogs. So, I know that's kind of boring to a lot of people, but my family does laugh at how completely obsessed with dogs I am. So. I chose obstetrics because after I watched the first delivery, I just thought, what an amazing thing to be part of this every day. And it really hasn't changed. I've been doing this for 14 years, and I still love doing deliveries. But there's still the aspect of gynecology, which I enjoy as well. Being able to help people with pain and irregular cycles and hormone issues. Our practice encompasses all of that, but I like the mix of both of them and having a variety of things to take care of people for every day. I'm a guideline girl. I usually follow the guidelines pretty closely, although sometimes, once again, I will change how I screen according to who the patient is. For example, pap smears. Pap smears can be spread out, but if I do have a patient that wants a pap smear annually, they can still have it. But in general, I'm a guideline girl and follow them pretty closely. Anyone starting a family should first meet with their OBGYN to review a variety of things. Take, for example, somebody that got married and they say, we're going to wait a year to conceive. At that point, we say, make sure you start a multivitamin, something that has folic acid in it, and we'll give them guidance in that way. Also, talk about their family history and offer genetic screening if there's anything that stands out. And even if there's not, people can still do a variety of genetic screens to check on their carrier status as well prior to conceiving.